Hey guys, welcome back to the channel and you all are welcome to yet another important vlog. So this is Dr. Abhishek and I'm reader in Department of Oral Medicine and Radiology in Bhubaneswar. So today's video is about topic se aapko pata chal gaya. Are we giving too much of analgesics to the patients? Is it right for the patients? See, there are many antibiotics and analgesics in the market. And today my topic will be I'll concentrate mainly on the analgesics, what we give to the patient. There are numerous analgesics, namely the most common Zerodol SP, Keterol DT, Lysoflam, Zerodol PT, Zerodol CR. There are so many companies which will provide different layers of different concentrations of analgesics, right from tramadol to Ultracet, and there are so many different kind of analgesics. And we often tend to get very confused ki what analgesics we should actually give to the patient. See, first of all, what I have noticed in my practice that many students and new practitioners and many of them, we prescribe a lot of analgesics. Not only everyone, even I am prescribing. So we are prescribing a lot of analgesics to the patient, and suppose we are doing an RCT, and after doing the RCT of the patient, suppose there is little bit pain, which is very common in the first sitting or after the first sitting or after the observation. So we tell the patient, okay, आप Zerodol SP खा लीजिए 3 दिन के लिए, खाना खाने के बाद तो इससे कम हो जाएगा. Suppose the pain doesn't reduce, then we tell the patient, okay, Zerodol SP से नहीं कम रहा, तो we'll give a higher painkiller like Zerodol PT, or we can give tramadol or Ultracet or any kind of etoricoxib 90 mg to the patient. Then still the patient doesn't reduce, then we resort to some other things which we know, or that is the thing. Main thing, we are not concentrating upon the main cause of the pain. So there are few points which I'll like to tell you कि किस तरीके से हम इस पेन को रिड्यूस कर सकते हैं. तो फर्स्ट ऑफ ऑल, usually it varies from various age groups, right? Suppose, for example, the patient is having TMJ muscular disorders, then what painkiller you should give? After extraction, what are the proper instructions? What is the protocol you have to do? After pedo extraction, what analgesics you should give, you should not give? So today, everything will be discussed. So first of all, we'll talk about RCT. So RCT, we usually, suppose we are sitting in a clinic and the patient comes to us, and usually if there is little bit pain, we tell the patient, okay, आप analgesics and antibiotics खाइए और 3 दिन बाद आइए. तो initially what happens is, usually first thing I'll tell you, 80% of the cases patient takes the medicine, patient doesn't come back to you, which is very common, and you all know this happens in the clinics. So that way there are both the patient and doctor is at loss. Doctor is at loss कैसे कि patient चला गया, patient कैसे at loss, patient he or she unnecessary took medications, and the pain will go, but again the pain will come back, and patient is having a prescription. So what happens is, patient again goes to the medicine store and he buys the drugs again without showing to the doctor, because 2 times तो ऐसा patient 100% करता है कि चलो वो डॉक्टर को अगर दिखाएंगे तो हमको तो फीस देना पड़ेगा, चलो उसी पैसे में मेडिसिन खरीद लेते हैं, फिर से कम हो जाएगा. So what we should do is, on the very first day of the appointment, we should convince the patient for starting of the treatment, because here we are not treating the root cause. What we are doing is, we are giving the medications. In case of swelling and all, वो तो अलग बात है, ठीक है. तो हमने यहाँ पे क्या किया, हमने यहाँ पे पहले medicine we gave, and patient took the medicine 2 to 3 times. Now again the patient comes back with a huge swelling, and then again you write the medication. So patient ने 3 से 4 बार खुद ब खुद analgesics लिए, जो कि it has a huge effect on the kidney and the liver. Okay, you see how many times the patient is causing himself damage by eating painkillers, and after that he's also hampering his GIT by causing gastritis, right? So painkillers we should avoid, जितना हो सके आप कम लिखें, and try to convince the patient for the first root canal or the extraction on the first day or on the second day itself, right? So while doing the root canal of the patient, what we do is, suppose हमारे clinic में crowd है and हमने root canal start कर दिया patient की, तो उस time पे what happens is, we open the pulp, and what we do, sometimes we put D pulp or famotidine and then send the patient, take money from the patient and then send the patient. Okay, the initial pain will be gone, but when the patient comes for the second appointment, the patient will have severe pain because there is some remnant pulpal tissue which is still there inside the pulp, because in the first sitting you had not done a proper BMP. आपने सिर्फ 8 नंबर 10 नंबर फाइल से उसका वर्किंग लेंथ ले लिया, इधर विद एपेक्स लोकेटर, और तो अगर आपने फर्स्ट डे काम चालू कर दिया है तो व्हाई नॉट टू डू BMP टिल 4% और 6%? Am I right or wrong? तो पहले दिन अगर पेशेंट आए तो BMP आप फिनिश कर दीजिए. यू फिनिश टिल 4% 25 और 6% 20. अगर इफ यू आर नॉट गेटिंग द कैनाल्स देन स्लोली यू शुड डू इट, because on the second day if the patient pain doesn't reduce, again we are giving lot of painkillers to the patient. We are giving Ketorol DT before the procedure sometimes or after the procedure, and the pain doesn't reduce, then you give another local anesthesia. So local anesthesia का डोज भी ज्यादा जा रहा है पेशेंट को. तो ये एक चीज है. तीसरी चीज, हम लोग कभी कभी क्या करते हैं जल्दबाजी में, what we do is we do not take the working length before starting the root canal. What we do is we prepare the canal in the very initial phases, and like we just do the coronal flaring and send the patient. Coronal flaring अगर आपको नहीं पता है, मतलब कि टूथ का जो कैनाल्स होता है, उसका जो ऑरिफिस होता है, उसको बड़ा करके थोड़ा सा PMP ऊपर ऊपर करके we send the patient if there is rush in the clinic, right? So always take the working length. What we do is, what mistake we do, or we often may create ledge in the canal, or we may perforate a canal, or we miss a canal, or sometimes we over obturate. So if you over obturate, then also the patient will have pain. Why we are over obturating? Because we are not taking the working length properly. So these are the factors in root canal which may lead to later pain, or sometimes what happens is while we giving sodium hypochlorite injection also, we give a lot of pressure. So that pressure should also be reduced, and the injection should go very passively while you are giving sodium hypochlorite irrigation inside the canals. So that may cause an excruciating pain at the later stages when the anesthesia wears off, right? अब दूसरी चीज ये होती है एक्सट्रैक्शन. अब एक्सट्रैक्शन में अगर आप प्रॉपरली, इफ यू डोंट ऑटोक्लेव योर इंस्ट्रूमेंट्स, व्हाट हैपेंस इज देयर मे बी चांसेस ऑफ इन्फेक्शन, और देयर मे बी चांसेस ऑफ ड्राई सॉकेट. देयर विल बी ड्राई सॉकेट इफ यू डोंट कंप्रेस द सॉकेट प्रॉपरली, right? So always have neat and clean instruments in your clinic. Suppose if you are not having molar forceps, buy 2-3 molar extra 2-3 molar forceps. Buy upper, जो कि commonly forceps use होते हैं, like molar forceps you should have 3, Copeland elevator you should have 3, and upper molar forceps also you should have 3 pairs. So whenever patient comes, you will have time to autoclave the instruments, or if you are not having time to autoclave, you can use the second instrument in your clinic. So that is the thing. Sometimes what happens is उसी वजह से there will be reinfection, and at that time patient will be having pain. Now a lot of people have seen pedo patients. What they do is, after doing the extraction, they just tell the parents to give medications. Even if the tooth is mobile, there is no need of giving any kind of painkillers to the pedo patient. We can just write a paracetamol or crocin syrup which is already there with the patient's home, because children, they will have like all this kind of fever and all, and their parents will be having crocin tablets or crocin syrup in their home. So what you should prescribe, you should tell the patient to take 2 teaspoons or 1 teaspoon of crocin before bedtime, and you should tell the patient to eat some ice cream or something like that. That will reduce the pain. There is no point in giving analgesic syrup like Flexon or Ibugesic Junior syrup. कोई जरूरत नहीं है. That's unnecessary use of medicines. So from the very beginning, we should try to, from the childhood age to the elderly age, we should avoid giving analgesics to any kind of patient, because we may not know how we are hampering and how patient is hampering himself or herself while taking these medications. So some patient develop a habit of taking analgesics, right? In my family, my nani used to take, कुछ भी पेन हुआ तो चलो एक लाइसोफाम ले आना. So she used to tell like this कि, so they develop a habit of taking medications all throughout their life. They don't show the doctor, and they avoid going to the doctor by just taking the medication. So मेरा main motive है इस वीडियो का कि कोई भी प्रॉब्लम है तो हमको प्रॉब्लम सॉल्व करना चाहिए, ना कि हमको मेडिसिन देके उस चीज को दबा देना चाहिए. That is the thing. And in the elderly patients also, many patients will be having TM disorders. TM joint disorders का कारण क्या होता है? First of all, stress, occlusal disharmony, absence of teeth in one arch. Suppose 4-5 से लेके 4-7 तक टीथ नहीं है, पेशेंट के ऊपर सारे टीथ हैं, फर्स्ट क्वाड्रेंट में, सेकंड क्वाड्रेंट में ऊपर टीथ नहीं, नीचे नहीं. So there will be occlusal disharmony, or patient will be having night grinding, or patient will be having without teeth, no teeth at all, or orthodontic problems. So these things has to be corrected first before giving any kind of medications for TM. हम लोग लिख देते हैं Zerodol TH4, Zerodol TH8, and there are so many medicines, Zerodol CR200, or CR means control release, Sometimes we also give zerodol. My favorite is zerodol PG, which contains pregabalin, but we have to know the psychology of the patient. We have to know the root cause. Then only we can give the proper medications to the patient. अगर आप ट्राइजेमिनल न्यूरल्जिया पेशेंट को जीरोडोल एसपी देते रहोगे तो उसका पेन कैसे खत्म होगा, राइट? वी नीड टू गिव कार्बामेजेपाइन और अदर एंटी एपिलेप्टिक ड्रग्स. सो रूट कॉज जाना बहुत जरूरी है, और सही एनाल्जेसिक सही टाइम पे देना और सही पेशेंट को देना, पेशेंट का एक्सेप्टेंस भी बहुत जरूरी है. तो आई होप आपको समझ में आया होगा इस वीडियो के थ्रू कि मैं एक्चुअली व्हाट आई एम ट्राइंग टू डिलीवर. So if you like this video, please give a like, thumbs up, or you can subscribe to this channel, and soon we are going to be a family of 50,000 subscribers. You can also join me as a channel member by pressing the join button, and you have to pay very less fees. It's around 30 rupees for a basic member, and advanced member ke liye 159 rupees. So you can join me and you can get special perks like video calls and all those things. And till then, have a very great day. Stay safe, stay at homes as much as possible, because the second wave of corona is going to come. I don't know when or whether it will come or not. That is also a question. So till then, have a very good day. Take care.